Ready? Hi, I have brought my patient JD here today. She's here for an annual wellness visit. Before she came in, I had her empty her bladder. She put on a gown. We got a full set of vitals, her height and weight. We tested her vision with the Snellen chart, and that was testing cranial nerve 2. I took a look at her appearance when she came in. She was well groomed, answered questions appropriately. Now I am looking at her face and her hair, her skin. Her skin is clear. Head is normal cephalic. I'm gonna palpate her scalp. There is no any tenderness on your scalp at all.
Nope.
No masses, no lesions. I'm going to palpate your facial bones, your maxillary and your facial sinuses. Any pain there? TMJ. Can I have you open your jaw? Any pain with that at all? No popping. All is good. Feeling okay? Like I said, her face is symmetrical. There was no tenderness when I palpate. Can you raise your eyebrows? Can you close your eyes tight? Can you open your mouth wide? Smile. Frown. Puff out your cheeks. That is all good. Stick your tongue out. Good. Clench your teeth. Wonderful. Can you tell me? I'm going to have you close your eyes, and then I want you to tell me if what you feel is soft or sharp. Okay? So tell me what you feel.
Soft.
Soft.
Sharp. Soft. Sharp.
Good. All right. So now I'm going to test, and I've tested for light stimulation with the Q-tip. All of that was good. Any pain with any of that?
Nope.
Wonderful. That is cranial nerve 5 and 7. Okay, eyes and eyebrows. Eyebrows are good. They are well distributed. They come all the way out. There's no lesions. Let's see, eyelashes are well distributed. They normal growth pattern. There's no redness or sclera is nice and white. That all looks good. I'm going to pull down on your eyes a little bit. Nice and pink. Good. I'm going to get a light, and we're going to look at your pupil. Okay, so I'm going to look in your eyes with my light. Pupils are round. They're reactive to the light. Good. We're going to test for accommodation. So I would like for you to look at the door and then look back at my scope. Eyes are accommodating. I would like for you to cover one eye. We're going to do one eye at a time. So cover one eye, and then I want you to fixate on the door back behind us. Great. Now uncover that eye and cover the other eye. Wonderful. We were observing for focus on the object. There was no abnormal eye movements. So we're going to follow the light on my scope. So I want you to follow the light with just your eyes, not your head. Great. That was cranial nerve 3, 4, and 6, and they are all intact. Next, we're going to look at the ears. The ears line up with the eyes. They're not too low. There's no lesions, no lumps, no tenderness when I tug.
No.
Feel okay? So now we're going to do the whisper test. Have you ever had any trouble with your hearing?
No.
Okay, I'm going to get behind you, and I'm going to whisper. I'm either going to whisper ABC or 1, 2, 3, and I want you to repeat what I say. So I'm going to start on this side, and then I'll come around to the other side, okay?
Okay.
2, 3. What did I say?
1, 2, 3.
Okay, let me go to the other side.
ABC.
Perfect. So now we're going to do the Weber test. With the tuning fork. The Weber test will make sure that hearing is equal on both sides. So we're going to place the tuning fork. It's going to vibrate. I'm going to place it on your head, and I want you to tell me if you hear it equally in both sides.
Okay. Yes.
Equally in both ears? Wonderful. Next we're going to do the Rhine test. We also use the tuning fork for that. I'm going to clip it on my hand and put it behind your ear, and I want you to nod your head when you don't hear the vibration anymore.
Okay.
Okay, so we're going to do your right ear.
Okay.
So tell me when you don't hear it vibrating.
Okay.
Now nod when you don't hear it in front of your ear anymore.
Okay.
Great. Now we're going to do it on the other side. Same thing. Nod your head when you don't hear the vibration anymore.
Okay.
Nod when you don't hear it this way anymore.
Okay.
Wonderful. That's cranial nerve 8, and that is grossly intact. Wonderful. So now we're going to look at the ear. Let me get a cover. So we're going to look inside the ear. Outside the ear looks good. I'm going to look inside the ear. No pain when I pull on it.
Nope.
Wonderful. Look inside your other ear. Sorry. Lean across you. Great. There was no bulging. Membrane is intact. It's a pearly gray. There's no fluid inside the ear. All looks good. No ear pain. Not having any ear pain today?
Nope.
Wonderful. So now we're going to look at the nose. The nose is symmetrical. No lesions, no trauma to the nose. There's no dark circles underneath her eyes. We're going to check to be sure both nostrils are patent and not obstructed. By doing that, we'll have her, if you could occlude one side and breathe through the other, great. And now the other side. No problems breathing like that. Wonderful. I'm going to test your smell. I'd like you to close your eyes.
Okay.
And tell me what you smell.
Oh, alcohol.
Alcohol. Wonderful. So smelling is intact. That's cranial nerve 1. I'm going to take the otoscope that I looked in your ears with, and I'm going to look in your nose. Wonderful. Good. Turbinates are not enlarged. Mucosa is nice and pink, moist. There's no swelling, no polyps. Nasal septum is intact. Wonderful. So we're going to look at the mouth and the pharynx. I just want you to open your mouth. I want to just inspect that it's nice. It's pink, moist. I'm going to look in the back. Frenulum is midline. Wonderful. Teeth are all intact. There's no inflammation on the gums. Okay, if you could stick your tongue out and move it side to side. Wonderful. Touch the top of your mouth with your tongue. Good, good. Tongue is mobile. There's no lesions. It's well palpated. Open your mouth and say, ah. Light. Sorry. There it is. Open your mouth and say ah. Great. Posterior pharynx, hard, soft palate are intact. Tonsils are visible, 1+, the perfect size. Cranial nerves 9, 10, and 12 are intact. So now I'm going to look at her neck. Neck is symmetrical. There's no masses or scars. I'm going to feel trachea is midline, no evidence of goiter or JVD. Next, I'm going to palpate for your lymph nodes. There's all kinds of lymph nodes. So I'm going to, the preocular, postocular, mandibular, cervical, the subclavicular. Good. There's no lymph enlargement. All feels good. Thyroid is midline, no goiter, no tenderness when I did any of that.
No.
Wonderful. I'm going to palpate your carotid arteries, just one at a time. Great. Symmetrical bilaterally, 2+. Wonderful. If you could please move your neck from side to side. Good. Up and down. Touch your chin to your chest. Good. Can you shrug your shoulders? Good. Move your head against my hand. Wonderful. Great. Now I'm going to have you take in a deep breath and hold it. Deep breath. Okay, you can let it out. Another deep breath. Hold it. Good. No evidence of bruise. Cranial nerve 11 is all intact. So I'm going to ask you to do some range of motion exercises. Again, if you could touch your chin to your chest. Good. Look side to side, that we just did that. Ear to shoulder. Good. Do you feel any pain when you do any of those movements? Wonderful. Can I take a look at your hands? Nails. Nails are good. There's no clubbing. All is good. Cap refill is less than 3 seconds. I'm going to palpate your pulses. Great. 2+. Muscle strength in your arms. I want you to put them straight out. Now raise them up. Great. Now push them down against me. Good. Muscle strength is 5 out of 5. Pretend like you are emptying a can with both thumbs down. Wonderful. Back up again. Now put your arms up over your head and back down. Any pain with any of that? Good. All right, now I'm going to look at your back and listen to your lungs back there. Can you sit up for me? I'm just going to move this pillow while you're sitting up. Looking at her back, skin is intact, no scars, no cyanosis. Cervical concavity, lumbar concavity, thoracic area is convex. I'm going to palpate. Let me know if you feel any pain while I'm palpating. Having any pain with any of that? Tenderness?
Nope.
Great. Can you say 99 for me?
99.
And again?
99.
And one more time.
99.
Good. Tactile pharmacis is equal and bilateral. I'm going to percuss. It's going to just feel like a little pounding on your back. I'm going to percuss and just make sure there's good resonance back here. Okay, so now I'm going to percuss and check for diaphragmatic excursion. So first I'm going to do the right side and then I will do the left. So I need you to take a deep breath in and hold it. Okay, you can take a breath and mark it. Okay, now take another deep breath in and hold it. Okay, you can breathe. So this time I want you to take a deep breath in and blow it all the way out and hold it, okay? So deep breath in and blow it all out. Okay, you can breathe. And then we're going to do that one more time. Deep breath in, blow it all out, and hold it. Okay, you can breathe. Okay, the differences between those is about 3 centimeters, which is perfectly normal. I'm going to check for CVA tenderness, so let me know if you feel any pain. It's going to be kind of a thud on your back, okay?
Okay.
Any pain with that?
Nope.
And again?
Nope.
Any pain? Okay, so now I'm just going to listen to sounds, okay?
Okay.
Get a couple deep breaths from you. And again. And again. One more time. Now, if you could say 99 each time you feel my stethoscope on your back.
99. 99. 99. 99.
Great. I hear muffled 99, so that is perfectly normal. Wonderful. Now, you can sit back. Let me raise your bed up a little bit. I'm going to take a peek at your chest. It's free of lesions. There's no scars. Respirations are even. I don't see any use of accessory muscles. Chest wall is symmetrical. I'm going to just palpate. Is that okay?
Mm-hmm.
Palpate your chest. Any pain with any palpation anywhere?
Nope.
Wonderful. No tenderness noted. I'm going to place my hands on your chest, and then I want you to say 99 for me, okay?
Okay. 99. 99. 99.
Wonderful. Tactile firmness is intact, equal, and bilateral. I'm going to percuss your chest and listen for resonance, okay?
Okay.
Good. I'm going to use my stethoscope and listen to your breath sounds. So we're going to start on the right aortic area, the pulmonic area, Erb's point, tricuspid and mitral valve, everything sounds equal. I can hear S1 and S2. No extra heart sounds. I hear no murmurs. I'm going to palpate the point of maximum impulse. Is it okay if I put my hands on?
Yeah.
Okay. Left side. And this is so that I can feel and palpate the artery. Pulsations are good. I can feel the PMI. Wonderful. I'm going to lay you all the way down now. Is that okay?
Mm-hmm.
And I'm going to listen to those heart sounds again. My sheet's popping off. All right. Are you comfortable?
Yes.
Okay. I'm going to listen to your chest again. No murmurs, no abnormal noises, what we like to hear. Wonderful. So now I'm going to look at your abdomen. Is that okay? Just have you lift up your shirt. Keep it covered. All right, abdomen is flat. It's non-distended. There's no scars, no lesions, rashes. Belly button is right in the middle. It's midline. I'm going to listen for bowel sounds.
Okay.
Great. Bowel sounds are normal active. Didn't hear any bruise, which is good. Now I'm going to palpate. First I'm going to palpate soft and then a little bit firmer. So let me know if you feel any pain. Okay? No pain or tenderness anywhere? Good. Now I'm going to percuss. I'm going to tap on it again just like I did. I'm going to be checking for tympany, which is what we like to hear on the abdomen. Wonderful. Okay, now I'm going to, I want you to take in a deep breath, and then I'm going to push down to feel for your liver, and then I'm going to do it on the other side too, okay? So deep breath in. It's going to be a deep palpation. Blow it out. Wonderful. We're going to do that again on the other side. Deep breath in. Blow it out. Good. Any pain with that at all?
Nope.
Okay. I'm going to feel on both sides. I'm going to palpate for your kidneys. Okay. So it's going to be kind of firm. Any pain with that at all?
Nope.
All right. I'm going to come around to the other side and do the other side. Any pain with that at all?
Nope.
Good. Wonderful. Okay, so let's cover you up now. We're all done with that. But I do want to take a look at your legs, so I'm going to pull the blanket up from the bottom.
Okay.
That's okay. So, legs, equal in size, no swelling, no bony areas or lesions. I'm going to check your pulses. Great. All right. Any pain in your ankles at all? Mm-hmm. Any pain with movement?
Nope.
Great. How about your knees? Any pain in your knees at all?
Nope.
Wonderful. Okay, so now I'm going to have you sit up. Let me raise your bed, and I'm going to test your reflexes.
Okay.
Good?
Yep.
So I will have you just throw your knees over to the side of the bed here. Good. Have you dangle? All right. I'm going to tap your knees lightly. Good reflex in that one. Do the other side. Great reflex in that one. Good. Okay. Next we need to test the muscle strength in your legs. So I'd like for you to push down. Oh, good job. Now pull up. Wonderful. Great. I'd like to do just a few more things. for your neuro exam. So I want to have you touch each finger to your thumb. Wonderful, great job. Now I'd like for you to alternate your hands back and forth. Wonderful. And your heel to shin. If you could put your heel to each shin. Wonderful, great job. Okay, so now I'll have you stand up, and I'd like for you to stand on one foot at a time and see how your balance is. So up one foot, great. Now switch to your other, great. I'd like for you to bend down and touch your toes. Wonderful. Spine is lateral. I'd like for you to spin backwards just a little bit and forwards just a little bit. Wonderful. Now both to sides. Lean to one side and then to the other. Great. Like you're popping your back. Can you kind of rotate back and forth? Great. Now I'd like for you to, this is the Romberg test. I want you to stand up straight and close your eyes to be sure that there's no swaying, but you're good. You're nice and straight. And I believe that is the end of my physical examination.